A new national survey has uncovered a worrying reality. Most Australians either don't understand multiple sclerosis or have completely outdated ideas about what life with MS actually looks like. So how far off the mark are we? And what does living with MS really involve today? Joining us now is neurologist Dr Lysandra Katelaris to unpack the findings, bust some myths, and help us become understanding and an often misunderstood condition. Dr Katelaris, thank you for your time this morning. Were you surprised by just how low awareness and understanding of MS is in Australia?
I certainly was. Yeah, I really thought that Australians knew a lot more about multiple sclerosis than what the survey indicated. So it was really interesting. But I have had conversations with patients, and in some ways it doesn't surprise me because a lot of patients feel almost dehumanized in some ways because people don't really understand what the condition is, and they still face a lot of misunderstanding and a lot of discrimination, even though today MS is a highly treatable condition when it's detected early.
Why do you think these outdated perceptions about MS, like needing a wheelchair, for instance, are still so widespread?
It's a great question, and I think a lot of it is because of people's personal experience and also because of, celebrities in the media and other people that they may have heard of that have been in wheelchairs, for example. And years ago, there were a number of patients that did end up in wheelchairs, but now with the better onset of treatment, diagnosis and treatment, that's really not happening nearly as often. And I think it's just taking a lot of time for people to understand that it is indeed a highly treatable condition and that we're now aiming for really good goals. So we're now aiming for basically absence of disease progression, and we're aiming most of the time to really try and halt the disease in its tracks by treating early and treating with effective therapy.
Can you explain what relapsing remitting MS actually is and how it differs from what people might assume?
Yeah, so relapsing remitting MS is a common condition when it comes to MS, and it really means that the MS actually comes in little flare-ups. So oftentimes patients will have episodes where, for example, they may go numb down one side of their body, or they may develop eye pain and different sort of sensory disturbances. And often these episodes will come and will go, and there'll be a process over time where the episode will come and go over a number of years. So they often do have periods in between relapses where they're not doing as badly. Although we do now know that every time that there is an insult to the nervous system, it does actually do permanent damage.
Now, the survey reveals a big drop in optimism at diagnosis. What's going through a patient's mind at that moment?
Those consultations where we're giving someone the MS diagnosis are quite interesting because I do find at diagnosis, the first thing a lot of patients ask me is, this sounds terrible, this sounds like a chronic illness, am I going to end up in a wheelchair? So people's minds always jump towards that worst case scenario. But often once we go through and we explain that, we're going to treat this and we're going to treat this quite aggressively and with high efficacy therapy, and that's not going to happen anymore really for the vast majority of patients. And really a lot of patients, once they're on treatment, live very normal lives, and it just means that they have to do a couple of MRIs a year and see their neurologist. But other than that, they can live really healthy and normal lives.
How accurate is the belief that people with MS can't work or live independently?
It's so inaccurate, and that's a lot of what we're trying to, a lot of the myths that we're trying to bust up after this survey has been completed, because so many patients work with MS, and I have a number of patients that actually don't even tell their employer and don't even tell people in their lives that they have MS because they choose not to, and then I have other patients that choose to disclose that diagnosis. But for the most part, a lot of my patients, once they're on treatment and they're stable, they really do very well, and they can work and they can live a very healthy and normal life. So it doesn't really impact them as much as I think they think it will.
Dr Katelaris, what are some of the biggest day-to-day challenges people with MS face that the public might not see?
Fatigue is a big one. I do think that that's something that we're still, as a neurology community, we're still working out the best way to combat that general sort of fatigue and brain fog that some patients experience. But I do also think that the fact that a lot of people don't know about their condition and don't understand what it is also causes a lot of stress for the patients. And also there are patients who may have, a relapse, for example, and they may be not very well one day, but then, the next time they're fine. And I think sometimes people can sometimes almost not doubt the patient, but there is a little bit of sometimes gaslighting almost that goes on where people say, oh, well, you were fine yesterday, so what's going on with you today? And I think the more that we educate the general population about what our patients with MS are going through, then the more support that they'll feel, and they'll be freer to just be themselves and not be worried so much about all the stigma. And really the stigma, as we saw in the survey, does often come simply from a lack of understanding, not from a place of malice. But I think it is really highlighting why it's so important for people to be educated about this condition as well as other chronic conditions.
Tell us about treatments and outcomes for MS and how they've improved in recent years.
Yeah, so there's definitely been a huge improvement with treatment. So years ago, we had very limited options with what we could give patients, and the interferons and some of those earlier treatments really did cause a lot of side effects without really doing a whole lot of good. And whereas now we have treatments that are immunomodulatory and really get in early and dampen down inflammation. And they modulate the immune system and the B cells and the T cells, and they stop essentially the immune system from attacking the nervous system. So the sooner that we treat, the more effective the long-term outcomes, because not only are we basically stopping relapses, we're actually stopping disease progression. And there have been a lot of studies to show that high efficacy treatment can actually prevent the brain from shrinking, so it can prevent brain atrophy and long-term cognitive damage. So they're very potent treatments, but they're also very effective. So it's really interesting. The terminology is quite interesting because we used to refer to some of the treatments as aggressive, but I think a lot of patients saw that as almost a negative thing because something that's aggressive isn't good. But now we're switching our terminology more towards high efficacy because they are highly effective and the side effect profile is much better than some of those more primitive sort of earlier medications that we had available at the time.
Now, Dr Katelaris, what role does the public understanding play in improving quality of life for people that are living with MS?
I think it's crucial because what I hear from my patients is that they want to be understood, they want to live a normal life, they want to have children and work and have a family and have friends and go out and do things and they should travel and they should have a normal life. And I think the problem in the community is that on the one hand you do have people who are quite well-meaning and want to help, but they almost make the patient feel like a patient at times when they just want to forget about it and enjoy their lives. And then on the other hand, there's people who can be quite critical and who put a little bit of a dampener, I think, on the patient's experience as a whole and say, well, do you really want to have children? Do you really want to work? And they put a bit of doubt into the patient's mind. So I think that if everyone's a little bit more on the same page in terms of understanding that, yes, it is a chronic illness, but we do have really effective ways now to manage it to a point where we want and we encourage patients now to work and to do things. And it's interesting because even employers often don't really understand what MS entails, because even yesterday I had to do a letter for a lady to say, yep, it's okay for her to work. I clear her medically to work. And really, we probably don't even need to be saying that. I mean, unless there are clear-cut deficits and issues, I think that sort of extra paperwork is probably fairly unnecessary, really.
Now, Dr Katelaris, a co-worker here whose mum lived with remitting relapsing MS for over 40 years, she believed being stubborn and fighting the good fight helped her longevity. Do you find people's attitude helps when symptoms start playing their part?
Absolutely. I find that my patients that do the best are the ones that have a positive attitude and also do have a bit of a fighting spirit. I think that helps. But I honestly think that stress plays a major role. So I think when people focus on their wellness and their general lifestyle factors for their brain health, I do think that helps. I mean, I have a patient who's done remarkably well and she makes sure that she exercises, she eats a low inflammatory, healthy sort of Mediterranean style diet, and she has friends and she goes out and she lives life. And I do think that having a positive attitude, but also listening to your body is really important. So I think patients shouldn't, if they are feeling unwell or tired that week, they shouldn't just force themselves and push through. I do think there is something to be said for rest, and also something to be said for understanding what can trigger a relapse. For example, we know that extreme heat can trigger relapse in some people. So I had a patient who was a marathon runner, and he had to be very, very careful about sort of avoiding extreme climates and humid countries and that sort of thing, because some people can be quite heat sensitive. Stress, certainly. I've seen people in the past relapse from episodes of severe stress and lack of sleep. So I do think the foundations for good health are really focusing on wellness and lifestyle and exercise and diet, and all the foundations need to be right as well. But I do think that, it is really important that we do start treatment early, because it's basically stopping the spread and stopping the destruction that's caused by the nervous system that's gone a bit rogue. So in a talk that I gave last year to some other neurologists and healthcare professionals, I came up with the analogy that it's almost like trying to treat a bushfire. You really want to put the fire out early. You don't want to just say, let's wait and watch and let the fire take control. And it's similar in the nervous system. You want to dampen down those rogue and overactive immune cells so that you can achieve much better outcomes and much less inflammation in the nervous system and the body.
All right. Hey, listen, thank you so much. You've opened our eyes up and we got a little bit more of an understanding of MS. Dr Lysandra Katelaris, thank you very much for sharing your Saturday morning with us.
That's my pleasure. You take care.
Such a pleasure to talk to her here on the Super Radio Network.